I'm Dr. Michael Murphy, and I'm a psychiatrist. I'm also the Executive Medical Director at River Oaks Treatment Center. I grew up in a small working class city in New England and saw a lot of people suffering from conditions including mental health conditions, substance use conditions, and just societal ills, and found that one of the pathways that I could help people the most is to learn as much as I could about health and about science, and then decided that medical school was the right route for me. I've been in psychiatry and behavioral health ever since I was really a third-year medical student. I fell in love with the field. I wasn't specifically interested initially in addiction medicine so much as psychiatry itself. And so I worked through residency and then after residency training doctors at Harvard Medical School and at McLean Hospital about chronic mental illness and how to treat patients over the long run. What I found when I was doing that work was that many patients had co-occurring disorders that and it was often under-recognized or underappreciated how much substances impacted the course of their illness. So I've only been in addiction medicine for a few years. I served in an executive capacity at the Hospital Corporation of America for 5 years, where I was overseeing behavioral health programs as well as addiction medicine programs. And when I left that role, I decided I wanted to get back into clinical care, but I wanted to do something more impactful around addiction medicine. And so I decided to join River Oaks. River Oaks has a wonderful culture of caring. You can tell from the moment you arrive on campus that people are here with a mission. They really care about each individual person, and the lives of these people matter. And that's a culture that I really warmly embrace. Any kind of addiction, whether it be smoking, drinking, cocaine, sexual addiction, all of these kinds of addictions are very hard to overcome. But there is hope. There are people out there that understand. There are peers that understand, that can help you get through the tough spots and really conquer this addiction problem once and for all. You have to be passionate about this patient population because at times it can be very challenging to deal with the mountain of problems that people bring, life problems dating back many decades with trauma, neglect, abuse. People come with very sad stories. They've harmed people in their lives. And so you have to have a passion for really helping people when they're at their lowest points. We have many clients that leave our program and months later will send an email back or send some pictures and tell us how well they're doing. And it's very gratifying. But even in the day in and day out, just seeing a person come in really looking terrible, feeling badly about themselves, and they leave here feeling healthier, ready to tackle the world, and you see that transition happen over just a few short weeks, and it's very gratifying.